Hi, it's Diederik here, and let me introduce you to Rose. Rose lives in Welby, and we came out to see Rose and Portia, her companion, a couple of weeks ago, or found her and to check their teeth out. And when we got close to Rose, we noticed a horrible smell, and it was coming from her mouth. And she has a disease that is newish, and does that mean that we're now recognising it, or does that mean it's now more common? And I don't have the answer for you on that. But Rose, when we lifted her lips up, had lots of black and staining around her teeth, and she has what's called periodontal disease. Peri means around, odontal is teeth, and she has periodontal disease of her incisors. If you just focus in, Kira. Hello, Rose. Now, her owner Elaine has been treating her wonderfully for the last 2 weeks, and her teeth are seriously improved, and she has that nice horsey smell breath now, not that horrible breath that she had. So let me show you what's happening here. I'll just use this stick as a pointer. You can see the gap in between the teeth here and there, and that was filled with black, horrible yuck the other day. And we have the same around this side here and this side there. So horses shouldn't have this blacky, stainy stuff on their teeth. And if you also have a look, you can see the way the food is getting caught in this space there. And notice when I'm just touching that area, she's just flinching, and I'm touching it ever so gently because this is horribly sore. So the other thing, I don't know if you can notice it or not, so the problem is mainly this incisor here, what's called the upper corner incisor, and this one here, which is, and so that's the right upper corner incisor, and this is the left upper corner incisor. If you have a really careful look, the gum over these incisors isn't normal, but it's relatively normal. If you have a look at this incisor, you can see the gum has receded way back. Now, the tooth sits in a socket of bone, and then the gum sits over the bone socket as a protective layer. So when the gum dies back, the bone dies back, and more of the root becomes exposed. And the more root becomes exposed, the more likely that tooth is to fall out, become loose, become rotten and fall out. And obviously it's a horribly painful process as well. So you can see the gum is slightly more purple in this whole area than it should be. If we compare the top gum and the bottom gum, she has the disease as well here, and you can see the cavities and the fissures there, but not as badly in the bottom as the top. So Elaine's been doing, as I said, a magnificent job, and she's been brushing her teeth, yes, brushing her teeth, and then flushing the area with a product called chlorhexidine or hibitane. And this is made up with in a special formula called Hexarinse, and Hexarinse is chlorhexidine with zinc. A normal chlorhexidine rinse would just be in and out in 5 minutes. The zinc bonds it to the teeth for 12 hours, so we have a 12-hour antibacterial property. So periodontal disease is a bacterial infection around the teeth. It's becoming, as I said, either more and more common, or we're seeing it more and more, and it can be the incisors, it can be the cheek teeth, or it can be the whole dang lot. What we're doing will slow her disease process down significantly. She's now 15. If this had remained untreated, she'd be losing incisors relatively quickly, probably within 12 months or so, I'm guessing. It's hard to predict how rapidly the disease progresses, but with what Elaine is doing, I'm hoping we put tooth loss off by many years. I still believe she will end up losing some teeth, but the longer she has her teeth, the better. And as I said, the big thing is that her breath is less smelly, it's back to normal. And the second thing, I didn't quite point it out, I mentioned it, but she's a lot less painful. This is a horribly painful disease. If you've ever had gum ulcers, that's the sort of pain. We just got back from looking at Rose, And there's a couple of extra things that popped into my head as we were driving back that I thought we should share. Periodontal disease in horses is the same as periodontal disease in dogs and cats and people. So we brush on a daily basis or twice a day to prevent periodontal disease. Horses obviously don't, but Rose is one horse that will need regular brushing. And the second thing is your horse. If you haven't had a good look at your horse's teeth recently, then have a really good look and see whether there's any bad smell in the mouth, whether you can smell any bad smell, or can you see areas of blackening or blackness around the incisors or even up at the cheek teeth. A lot harder to tell with the cheek teeth, but you know, with the torch you can have a look. So I guess that's the big take-home message from this video, is that horses can get periodontal disease. If you treat them early, you can manage it really well. If it's advanced and you don't treat it, then that horse has got a lot of pain and will lose a lot of teeth. So see you in the next video.